Mental Health Care Advocacy video by Laura Leitner. Should the governments grant higher priority to the care of mental health? If a person starts suffering from mental health problems, what is next? Where can this patient receive attention for his mental health problems? Unfortunately, mental health services tend to occupy a low priority on public health agenda, with significant budget, policy, and service implications. Therefore, our city and county governments must work together to unite forces supporting the mental health services provided to the El Paso community. If nothing is done by our authorities, what will the consequences be? Many students that require mental health care will not receive it. And instead of benefiting from a good education, they will saturate the health services provided by the school districts. It can also increase their risk for truancy, delinquency, or illegal drug use. Out in the community, patients with mental health disorders will be forced to seek attention at the community hospitals, which will then become overloaded and unable to provide health care for the rest of the population. Patients in need who never received care can end up on the streets, in prison, or dead. On the streets, the homeless population will continue to increase. And without any attention or care, many of the homeless will just die. Persons already within the prison systems will require mental health care and will further strain the institution's budget constraints. What can we do? Fortunately, there is still hope. Community awareness and population education about the mental health problems that we are facing are at the core of the solution. We need to get informed, stay updated, then get involved. With the ultimate purpose of making mental health care a priority to our governments. So they will include the cost of mental health services in their budgets, allowing the underfunded institutions like MHMR to adequately provide the necessary mental health care. Mental health patients will then receive the needed care. Permitting our schools to educate, and the school health services to provide adequate care. Our hospitals will be able to provide better medical care. Support groups will prove more beneficial. Patients that previously had no hope for treatment will now have the opportunity to recover. Families separated by mental health illness will be able to get back together. Finally, the mental health patient will be given the opportunity to live a healthier, happier, and more productive life.